Hey everyone, Luke here, and today we're talking about the 3 phases of healing. And in the blog post that I have this video kind of embedded with, the scenario that I give is a young gal who came in not too long ago, probably in her mid-20s to late 20s, and she's got a job where she walks a lot, so she's on her feet all day long, and she's got one of the little Fitbits, so she likes to keep track and push up to 10,000, 15,000 steps a day. And so over time, she develops this injury along the backside of her ankle, which you have some little tendons. If you go along the inside of your ankle and then towards the back, kind of between that little ankle bone and the Achilles tendon, there's little tendons that run there. And it's kind of a common overuse injury. But what happened when she came to me is she had already been in the walking boot, so she went and saw a foot specialist. The foot specialist puts her in the walking boot, and about 4 weeks later, she's feeling pretty good. Now, what the walking boot has done for her is it's taken all of the pressure off of that tendon, because basically when she's in that big black boot walking around, her ankle isn't moving. So her ankle is pretty tight by now, of course, too. But anyway, so you take all the pressure off those tendons, they're not working. After 4 weeks, she's feeling really good. So the foot specialist says, okay, take the boot off, go back to work. So she does that for about a day, and then of course, as you can imagine, her ankle is just screaming at her again, and that those tendons are just as irritated and inflamed as they were before that. So what happened there was basically they didn't really understand the 3 phases of healing. Another good analogy is you went from 0 to 60, in one day, and your body just can't adapt to that. So we've got our little fancy sheet here for the 3 phases of recovery. I'll kind of zoom in there for you so you can see it a little better. So you've got 1, 2, 3. And basically, what we explain to people is that your 3 phases of recovery go like this. In the first phase, whatever your body part is, whether it's your ankle, your shoulder, your back, it's very irritated. And before you can get to doing a lot of activity like this guy was trying to do, you have to get that irritation and that pain level down. You have to really get everything just calmed down. And then as you're feeling good there, then you can start to progress up into that second phase, which the second phase is where now you're starting to look a little more at flexibility and strength. And that's basically what this gal mainly skipped. She went straight to the third phase, which the third phase is when you're returning back to your normal activities. In her situation, that's frequent walking at work. For you, it could be, if it's a shoulder injury, it could be certain reaching activities that are real painful, or it could be a specific sport or activity, golfing, hiking, running, whatever it is. That's phase 3. So again, if you look at the 3 phases here, phase 1 is this red one here. And so that's, again, we're getting rid of the inflammation and the pain. Then you're moving into this yellow one here, where you're focusing more on your flexibility and strength. And then finally, you're taking those gains you've made in phase 2 with the area being stronger and more flexible, and you're going to apply those to phase 3, and you're going to get into some specific activities that are more important to you. And again, that's different for everyone depending on the injury. So again, that's when she came in for physical therapy. That's what we focused on. We kind of had to start way back in at phase 1 again and get everything calmed down. That's a little more passive treatment, a little more hands-on, things like massage, and then you're getting into stretching, exercising, and finally you're getting into, for her, a lot of different walking and more kind of dynamic exercises and stuff. And again, you can apply this same mentality to any injury. A real common one that I like to use this description for is a shoulder injury. So probably second most common thing we treat here in the clinic besides low back pain is this kind of, we call it insidious shoulder pain, where you haven't really done anything. It's a fancy word, of course, but it means you didn't injure it. It just, over time, your shoulder starts to hurt. And what happens is it's usually a rotator cuff issue. You say, okay, well, obviously right now all of these movements hurt. So if we just jump straight into trying to stretch the shoulder and strengthen it, we're just going to keep it inflamed the whole time. So we've got to really focus early on, cut out these activities that really cause you inflammation. You say, well, every time I do this and this and this, it really bothers me. Every time I try to reach here or lift my kid or my grandkid here, say, okay, well, delete those, eliminate those or reduce them as much as you can in that early phase, with the goal, knowing that it's temporary, but within hopefully the first 2 weeks or so of therapy, you're really getting your pain level down. Then you can make that leap to phase 2 where you're working on specific stretches and specific exercises. And once you're getting it all strong and feeling good and mobile, then you can make that next jump into phase 3 where now we're working on, okay, well, it's much more difficult to reach out here and extend, or it's much more difficult to lift your kid into the car seat. or any other number of things you could do with the shoulder. So again, works really well. If you're trying to self-treat, again, just know the process and know that before you can, if you're getting a little antsy, before you can jump in and do a bunch of exercises, you've got to get the pain level down. And again, a lot of that is just cutting out activities that aggravate the pain. A little bit of rest, of course, is good in there, but not too much, because then you'll be prolonging the process. Icing is usually good, things like that. So again, if you're self-treating or trying to, just understand it, respect the process. Obviously, as physical therapists, this is what we do day in and day out, is kind of just guide people through the process, and then add in things like hands-on therapy to make it go a little faster as well. But if you have questions specific to that, please let me know. Otherwise, I hope the information helps, and I will talk to you guys soon. Thanks.